So looking at a multimodal strategy at trying to reduce surgical site infections in sub-Saharan Africa. The SAS project has worked extremely well in the US, and the WHO in collaboration with Johns Hopkins approached 5 hospitals, identified project leads from those hospitals. We sat together and looked at aspects of interventions, process measures that we thought we could affordably institute in our institutions without too much resource drain, and would be able to institute and then see their effect on the reduction of surgical site infections in our environment, with the hope that if they were successful, if those measures were successful and affordable, the same model could be applied in other hospitals in our countries, but also in other environments that are similar to ours. And I must say that we have so far been successful in the process, and have shown significant reductions in surgical site infections. The other advantage of our project is that we are using classifications, CDC classifications, and other terminology that has not been used in a lot of literature, in African literature in the past. But now we're able to compare data from Africa with data from the West, from Europe, from the US. I guess the message would be that the perceived resource constraints that our environments appear to have should not be an obstacle to patient safety, to instituting blocks, to or programs that would help us cut down on patient morbidities and mortalities, and the fact that patient safety is a completely new concept in sub-Saharan Africa. So that is an obstacle to overcome, but when people are interested within those institutions, anything is possible. It's an honor for me and my hospital to come to this event. It represents, I'm a surgeon, so it's a little strange for a surgeon to be in this community, because this is a community of infection control personnel. But I'm comfortable because I have an interest in the interest that they have in, and it's an honor to come and meet very big names in infection control in the world, and to be able to make a lot of connections and networks with industrial players, but also other physicians and nurses, that where we can collaborate and improve our practice back home, as well as the knowledge that I've been able to collect that I can go back home and share.